Now let's dive deep into this big LGBTQ story for today. I'm Vaughn Biggs, and let's queer Black community. Statistics is just one part of the full story of Black queer people with HIV. Jordan J. Edwards, Deputy Director of the Normal Anomaly Initiative, has shared his powerful journey of National Black HIV/AIDS Awareness Day in an article for LGBTQ Nation. Edwards reflects on his personal experience with HIV, calling for a shift from mere statistics to storytelling. He says, quote, "HIV has never been just a statistic for me. Yes, we can acknowledge that Black, gay, and bisexual men are the most affected by HIV, but ending HIV isn't just about spreading awareness for one day," end quote. He recalls how the epidemic shaped his life from an early age. Diagnosed in 2013, Edwards turned his journey into advocacy, earning recognition from Houston's African American State of Emergency Task Force and attending the White House Rising Leaders Summit. He urges communities to fight stigma, systemic racism, and healthcare inequalities. He calls for ongoing action, equality in healthcare, and open conversations. Edwards champions the future where stories, not statistics, define the fight against HIV. I did a little bit of research on him, which was amazing to me because of his story and his backgrounds. But the thing that I love that he is, the word that he uses to describe his sexuality, which is that fluid sexuality, and because of that, has allowed him to move in areas that some people might not have been able to move into, and that just talks to his resilience, I think, of what he's been able to do and accomplish during that time. And the other notes was he focuses on diversity. In everything he does, he's focusing on diversity, and that's something we have to do. We say that here a lot of times. We have to focus on that. But do we really? And sometimes I question that. Are we really focusing on those people that we need to focus on to end this? And it is more than just statistics. I love the idea of storytelling. I mean, that's how people are going to learn in our community.
Well, I mean, I'm sure you can comment on this better than I can, but I've spoken, I know Paul Thomas, who does queer news here, and talking about where the resources are in the community for HIV and treatment and testing, and the centers, whether it's in Miami-Dade County and they're on Miami Beach, but what happens if you live in Homestead? Right. And if you're, we have them here in Wilton Manors, but what happens if you live way out in Margate and you don't have a clinic or something near you? How are those people getting services, and how are we spreading diversity of socioeconomic backgrounds, diversity of where people live and how they gather, and diversity of their community, of where they feel comfortable? Because someone may not come to Wilton Manors who is DL and doesn't want to be exposed to come to a gay area to get a HIV test, right?
Hasn't Dr. Summers is with Pride Lines, right?
Yeah.
Right.
He's talked about that, how they have other offices and locations.
Pride Lines is definitely expanding into a lot of more.
And you're right. And I see a lot of areas that, listen, when organizations want to go out and do an impact in the community, a lot of times they go for that lower fruit.
Yeah.
So where's the lower fruit? Wilton Manors. They're not going to go out to Weston. They're not going to go out to other areas of Broward County to reach them. But what I'm hopeful is, and I like to think so, because I know for us, it's been very successful with Holy Cross Health, and that is, this whole mail order for HIV self testing kit.
Mister.
Right. Yeah. So you can actually have a kit sent free to your home. You do it in an oral swab, and you get your results in 20 minutes. You get the information to go, okay, if it's positive or reactive, this is what you need to do. If it's not, this is what you need to do.
Yeah.
But at least there's ways of getting it out there that they've never had before.
Sure.
They've had these kits out way before COVID happened. The problem is they didn't really take off until after COVID tests came out, because it was so simple to have done, because it is just an oral swab.
And it's also important to remember that two organizations, CAN and AHF, are sitting on billions of dollars, and they're nonprofits. And they could invest in this if they were asked to or forced to, because obviously they're sitting on huge amounts of money. They're supporting some organizations, but many of the organizations they support are organizations that give them patience, which means they make even more money.
Right.
So it's time for them to invest in the community in ways that they haven't, especially with the political climate.
Yeah.
And we've got to get away from, well, I love mobile testing. You know, mobile testing units is a great resource, but people know it as an HIV testing van or an STI testing van, just like they used to call I think in New York now, it was interesting, they no longer call it an STD clinic. They call it a sexual wellness clinic. And to me, it's like,
stigma.
change the name,
Right.
get rid of that stigma that's attached to it, you know, so that we can start normalizing the conversation and reach many more people in the community.
I agree.
So, yeah.
I agree.
Well, that is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.